Martin.
Good evening. My name is Dr. Michael Martin. I'm a pediatrician in Tyson's Corner. I also serve as the president of the Virginia chapter of the American Academy of Pediatrics. Schools are vital in children's educational, social, physical, and emotional development, as well as being a source of special services and nutrition. Without full-time in-person access to the support system schools provide, disparities among students who are Black, Hispanic, American Indian, and living in poverty in Fairfax County will continue to widen. In the background of 98% of surveyed pediatricians in our state reporting increases in anxiety and depression, respectively, we also know that inequity exists in social supports for these same students suffering these tragic mental health outcomes that are rapidly rising. Children cannot survive on 7-hour Zoom sessions for months at a time, missing the in-person connections with peers and teachers. And I can share with you today was a typical day for me. I put one new patient on Prozac, and I put one new patient on Concerta, and that's pretty much every day for the last several weeks. Both the national and Virginia chapter of the American Academy of Pediatrics strongly advocate that all policy considerations for school COVID-19 plans start with the goal of having students physically present in school full-time. Success for school reopening relies not on a single action, but the layering of mitigation steps that includes masking, hand washing, and physical distancing to the extent possible. Data shows low COVID-19 spread in schools when simple mitigation is done consistently, and that schools can be successful in opening during all levels of community transmission. The AAP states schools should weigh the benefits of strict adherence to a 6-foot spacing rule between students with potential downside if remote learning is the only alternative. We recommend that schools focus on keeping distance to the extent possible, especially between adults and during times without masking. 3 feet is widely used in educational settings with success in the US, including in Virginia, and around the world in all levels of community spread. Schools should not stay closed or hybrid because they cannot implement strict 6 feet distancing between students when ample evidence supports the use of 3 feet. Schools should strive to achieve the greatest extent possible. Children absolutely need to return to in-school learning for their healthy development and well-being. We know the absence of in-person school has widened health and educational inequity, as many children are suffering without the support of in-person classroom experiences. I and the Virginia AAP chapter urge safe reopening of schools based on science and to avoid needless harm to the children in an unequal way. Returning to full-time in-person learning is the best prescription to narrow the inequity gap for our children during a pandemic that has no clear end in sight. It is clear that schools can open safely and learning